Texas hospitals accumulated more than $1 billion in healthcare costs for illegal immigrants during fiscal year 2025, the first year the state began tracking the figures. The data, compiled by the Texas Health and Human Services Commission and obtained by Texas Scorecard, shows hospitals logged 313,742 visits linked to individuals not legally present, with total costs reaching $1.05 billion by the end of the fiscal year. Texas's fiscal year runs from September 1st through August 31st, but hospitals were only required to begin reporting in November. Based on the reported data, costs averaged approximately $105 million per month, indicating that the true annual total could be significantly higher. To put the figures into perspective, the reported hospital costs approach about 1% of the state's tax-funded resources. The figures were collected under an executive order signed by Governor Greg Abbott in August 2024 that mandated the agency track the number of individuals not lawfully present in the U.S. who use Texas public hospitals. Abbott's executive order directed Texas hospitals to provide HHSC with quarterly breakdowns on patients not lawfully present in the U.S., including the number of inpatient discharges, emergency department visits, and the cost of care provided to these patients. Texas, a border state, reported some of the highest crossing numbers ever recorded under the Biden administration, putting immense pressure on its healthcare system, Andrew Mahalaris, Abbott's press secretary, told the media previously. Earlier, at a Senate Homeland Security Committee hearing, Senator Josh Hawley questioned witnesses about exempting healthcare spending from taxation.
Senator Hawley, thanks for coming.
Yeah, absolutely.
Floor is yours.
Thank you. Oh, dangerous thing to say. Thank you, Mr. Chairman. And thanks for waiting for me. I'm just coming from another briefing.
I didn't. I just kept droning on.
Well, it worked to my advantage. I'll be brief. I know the panel's been here for a long time, and I'll give each of you some questions for the record. But I just want to ask you, Mr. White, nice to see you again. I think I saw you recently in another hearing, and you've gotten the question I'm about to give to the panel. But let me just ask you this. Here's an idea to lower healthcare costs. What do you think about exempting healthcare spending, consumer spending, from taxes? What if we just said, no taxes on healthcare spending? Your premiums, tax-free. Your deductible, tax-free. Your out-of-pocket expenses, tax-free. We already have, as I think Mr. White pointed out in a hearing recently, we have in place an approximation of this. If you itemize as an individual, if you itemize your taxes and you spend more than 7.5% of your adjusted gross income on out-of-pocket expenses, you can deduct everything above 7.5% if you itemize. Of course, businesses, big corporations get to deduct all of their spending. So why not allow individuals to deduct everything, first dollar, make it tax-free? What do you think? Let's just go down the panel, and then I'll give you questions for the record. Go ahead, Mr. Lehman. Do you want to pay less? Do you want to pay less taxes on your health care? That's the question. Who's going to say yes to that? But maybe somebody will. Go ahead.
I'm afraid I do not have the expertgoing of the tax code in front of me to give you a really good answer on that. Thank you.
Okay, Mr. Jacobs.
I'm going to follow this gentleman right here. I mean, I'm not that guy. I'm not the guy to ask this question to.
Mr. Reagan.
Senator Hawley, I think it's a great idea because then you're providing fairness to everyone. Whether I pay out of pocket or a premium or have some alternative, you're treating it the same. And government should be fair. It shouldn't pick winners and losers. Great idea.
Now, Mr. White, you said actually the other day, and I thought this was a great point, taxes make everything more expensive. So if you want to reduce costs, why not lower taxes, in this case on health care, which are exorbitant. But go ahead. I'll let you fill in or not.
My answer hasn't changed. Great idea. We should do it.
Great. Mr. Steele.
Senator, I have 4 kids, so I'm in favor of lower taxes.
Yeah, very good. Mr. Briggs.
Would have made a big difference in my life if that had happened.
Yeah. All right. Well, thank you all for being here. Thank you for your testimony and your expertise. Like I said, I'll have some questions for the record, but I'm sure you're eager to catch your breath. Thank you for waiting for
Senator Hawley's going to give those 4 $20. You want to take a shot at getting $20 from Senator Hawley for just by saying yes, it's a great idea? Apparently not. I think with that, there's more ways to skin a cat here, right? I do think Republicans have a lot of good ideas on how to do this. The question is, how do you implement it? How do you implement it where you have Obamacare's structure still there? When you start bleeding people off of Obamacare, that's going to make it even worse for those exchanges. You kind of got to start from the ground up, truthfully. But also understand we're really talking about a pretty narrow percentage of the American public on the exchanges, which has kind of screwed so many things up. It's, you know, how do you bust up some of these oligopolies, truthfully? I mean, we got to figure out antitrust. They've consolidated. We need to restore competition. Again, that's my main point. The main principle, you need competitive markets. You need consumers worried about how much they're paying for things. And I think you just, Senator Scott mentioned that surgeon in Oklahoma. Cash on the barrel had his rates for surgery were 10% of what hospitals are charging. I mean, that's remarkable. But that's what's possible out there if we can bring consumers back into this. So again, I appreciate the fact Senator Slotkin wants to work with us. If that's true, happy to do it. But we really do need the other side to admit they have a problem, not say this is the greatest thing since sliced bread. There's no problem here. Just throw hundreds of billions of dollars at it. That's not a solution. It's not certainly something that I can support. But I truly do appreciate all your witnesses. I will give you, if you do it briefly, we'll start with Mr. Briggs. Do you have a final comment that's just burning that you got to get out there?
Yeah, I do actually, and it comes down to this question of fairness. So I was trying to explain to my family a few years ago, like, why is Dad so exercised about our problem, right? And I said, well, imagine, you go to the grocery store last week and you went and bought your favorite candy bar. Say it's a Snickers bar. And you've been doing this for a while, and last week, like every other time you went there, and it would cost $1.50. Price is right on that thing. You go to the cash register, and you pay for it. It's $1.50. Elon Musk is behind you. He buys a candy bar. It's $1.50. Someone from the lower middle class is $1.50. So the way we sell health care in this country, at least under Obamacare, is as follows. You go into the grocery store. There are no prices on anything. You take that candy bar to the cash register, and you say, look, there's no prices. What happened? What are you going to charge me for this? And the register, the cash register, the cashier says, show me your taxable income. And then I'll tell you how much I'm going to charge you for it. So for me, it's $5. For the guy behind me, it's $1,000. For someone behind me, it's $2. So what we no longer can suffer under anymore is the equity of fair cost. This is what we really need is the equality of real prices. And that's the huge difference. I have no idea how much I'm going to be charged when I bring my cancer-ridden daughter in for any of her treatments, big or small. Right. And this is the problem. Equity of fair cost will destroy us. Equality of pricing is the answer.
And having consumers do this, that literally solves the problems. Mr. Staley.
Thank you, Senator. I would just say that every dollar that is spent on an able-bodied adult is a dollar that can't be spent on the truly needy. And so as Congress looks to address this, one of the most important things that has to be looked at is the fact that we have these perverse incentives that were created by Obamacare. And unless that's taken care of, the truly needy will continue to be at the back of the line.